Hi, my name's Kevin. I'll be assessing you today. What is your name?
Nicole,
And what brings you in today?
wellness exam.
Perfect. I'm going to wash my hands. I know the MA has already grabbed your vital signs, height and weight, and checked your vision and hearing. What is the date today?
March 4th,
And the day of the week?
Thursday.
And who's the president?
Joe Biden.
Good. We're just going to do a general exam here. We're going to start with your head and face, just observing for symmetry, lesions, which there are none, and then we're going to inspect the scalp. We're noting cleanliness and no infestation. I'm going to palpate. Let me know if there's any tenderness there.
No.
Okay. We're going to check cranial nerve 5. I'm going to have you open your jaw and side to side. Good. No clicking. Any tenderness there?
No.
Good. We're going to check cranial nerve 7. Have you smile for me. Good. Raise your eyebrows and puff out your cheeks. Don't let me push the air out. Good. Cranial nerve 7 is intact as well as 5 earlier. We're going to move on to the eyes. We're going to first just observe that they are symmetric, closing bilaterally. Eyelashes on the top are going up and on the bottom are going down. We are going to palpate the lacrimal ducts. Any tenderness there?
No.
Good. And there's no discharge. I'm going to do a couple tests here. We're going to first check cranial nerves 3, 4, and 6. So I'm going to have you follow my finger. I'm going to go in an H pattern here. Good. And we're going to come in for accommodation. And the eyes cross. Good. Cranial nerve 3, 4, and 6, that cardinal gaze, extraocular movements, and accommodation is intact. I'm going to do a cover-uncover test with you, checking muscle stability. So with your right hand, cover that right eye. Looking for gaze with the other, which there is not. I'm going to have you switch. Same thing. We're looking for that gaze, which there is not. Going to shine the pen light here in your eye. Good. Pupil is constricting and constricts on that side, both equal, responsive, reactive to light. I'm going to shine at your nose here, looking for that corneal light reflex. We see that bilaterally in both pupils. And we're going to take a look here in your eyes, do your fundoscopic exam. And we're seeing that red light reflex. Corneal nerves are intact, no nicking. Optic disc, no cupping. And creamy orange color there in the other eye. Same thing, we're seeing that red light reflex. No nicking of the optic nerves, no cupping of the optic disc. And same color, that creamy orange. We're going to move on to the ears. We're going to observe that the pinna are lined up with the outer canthus of the eyes. We're going to check for any tenderness. Any tenderness there?
No.
Okay, good. We're going to take a look. And the MA, when she tested your hearing at the beginning, tested cranial nerve 8. We're going to take a look in the ear, seeing no redness, no swelling. Tympanic membrane is pearly gray. Cone of light is at 7 o'clock on the left side there. Here on the right, pulling that up and back. Again, tympanic membrane, pearly gray. Cone of light at 5 o'clock. No swelling. Good. Thank you, Cole. We're going to move on to the nose. We're observing that it is symmetric. No bumps, no lesions. We're going to palpate. Let me know any tenderness there.
No.
Good. We're going to palpate your sinuses. Any tenderness there?
No.
And up here?
Nope.
Okay, good. We're going to have you check just patency of your nose. So have you cover one, blow out, and other side. Good. Both nares are patent. I'll have you lift up, just observing them
mucosa, it is pink and moist. There is no drainage. Checking internally, turbinates are not enlarged. Are you having any issues with swallowing, or excuse me, taste or smell?
No.
Okay, good. Cranial nerve 1 is intact. We're going to take a look at the mouth now. Looking at the lips, they are symmetric. There's no lesions. They are pink and moist. In a test, cranial nerves 9 and 10. I'm going to have you open your mouth, say ah, and stick that tongue out. Good. Cranial nerves 9 and 10 are intact. Say ah again. I'm just going to take a look at your tonsils. They are not enlarged. Grade is 0. Tongue is midline, pink and moist. I'm going to check the hard palate. It is fused. Buccal membranes are pink and moist. Soft palate is pink, moist, and intact. Raise your tongue up to the ceiling. And floor of the mouth is pink and moist. No lesions there. Dental work, there is none of. All teeth are intact. No issues with any foul odor. In the conversation that we have had, I can see that cranial nerve 12 is intact. We're going to move on to the neck. We are looking that the trachea is midline. There is, it's dry, no lesions. We're going to palpate the carotid pulse. Good. We are going to listen with the bell of our stethoscope for any bruit of the carotid pulse. Which there is none. We're going to palpate lymph nodes. And you're going to let me know any tenderness here. Preauricular, postauricular, postcervical, anterior cervical, submandibular, submental, and supraclavicular.
No tenderness.
Thank you. We're going to check cranial nerve 11 here. I'm going to have you shrug your shoulders. Good. Then I'm going to have you push against my cheek, or push against my hand against your cheek. Good. Cranial nerve 11 is intact. We're going to do a swallow test to check the thyroid. So, give me a sec. I'm going to have you swallow for me. Good. Any tenderness there?
Nope.
Okay. And no masses, no hardening with that. We're going to move on to the upper extremities. So we're noticing that the shoulders, clavicle, and the scapula are symmetric. There is no lesions, no nevus. We are going to test for tenderness. Just going to palpate those shoulders, chromium process. Any tenderness there, Nicole?
No.
Good. Coming down to hands and fingers. Any tenderness there?
No.
Cap refill is less than 3 seconds. We're going to test range of motion. So I'm going to have you hands behind, kind of reach other way. Good. We're going to go hands all the way up and back. Good. And back down. Going to go elbows and wrists and hands. Any tenderness there?
No.
Okay, good. We're going to check deep tendon reflexes here. So just relax that hand, that arm in my hand. Good. Tricep, good. Brachial and wrist. Good. Other arm here. Again, just give me that weight. Good. And brachial. Good. And wrist. Good. So we're going to move on to the posterior back. I'm going to have you kind of face this way so I can get a listen here. Excuse me, I'm going to take a drink. So we're going to inspect here the skin first. We're just checking to see that the skin is the same color as the rest of the body. No lacerations, no lesions. We're going to listen to the lungs. We're also kind of noting when we're looking that the AP diameter is 1 to 2. So each time I place the stethoscope, I'm going to have you take a deep breath. Good. Clear through, out. You're going to do the same thing, but you're going to say 99 each time I place the stethoscope.
99, 99, 99, 99, 99, 99, 99.
Good. And we're just hearing that those sounds are muffled. We're going to do tactile fremitus now. So same thing. You're going to say 99.
99, 99, 99, 99.
Good. And basically we're just seeing that the vibration of that is lessened as we move down. We're going to just percuss the posterior back here, those lungs, sounding resonant. And then we're going to check, I'm going to check on the side real quick. Good, resonant. We're going to check lung expansion. Take a deep breath. Perfect. That lung expanding equally bilaterally. Nicole, I'm going to have you come and lay down. You can put your head over here. And we're going to finish listening to the lungs here. We're first observing the anterior thorax. Same thing as the back. We're looking at color, any lesions, and we're going to take a listen. So a nice deep breath. Good. We're going to listen to heart sounds now. Excuse me. Should sit up, huh? I need you to sit up for me.
Okay.
Sorry about that.
No worries.
Come sit over here. We're going to listen to those anterior lung sounds again, sitting. So nice deep breath. Good. Good. We're going to listen to the heart. Just breathe normal for me. We're listening in 5 locations. And we don't hear S1, S2 are present. No adventitious lung sounds. No extra heart sounds. We're going to palpate the apical pulse, which a lot of times is easier to do laying down. So now I'll have you lay down.
Okay.
And then we'll finish listening to those heart sounds again, laying down. And just kind of faint pulse there. We'll listen to those heart sounds with then we'll listen with the bell for any bruise. Good. And no bruise are heard. S1, S2 again is present. We're going to move on to the abdomen here. We're going to first inspect. We are looking at no discoloration, same color as the rest of the body. It is no distension, or abnormal coloring. We're going to first listen to the vowel sounds. And they are normal active throughout. We're going to listen to the aorta with the bell, the renal arteries, iliac, and the femoral. We're listening for any bruits, not hearing any. We're going to percuss the abdomen first, just generally. Excuse me, Nicole. Sorry about that. Let me use my hand sanitizer again. All right, we're going to continue percussing and resonant throughout. We are going to palpate, we're going to continue percussing the spleen. So I'm going to have you take a nice deep breath in and out. Good. No change in sound. Spleen is not enlarged. We're going to percuss the liver, and we're checking kind of the size of the liver. So we're going to do a top down and then a bottom up approach to find that gap. And when we hear it a little more dull, that's our top point. And then we come from the umbilicus up. And there's kind of our spot. And right in that 4 to 6 centimeter range. We're going to do a little light palpation. Any tenderness there?
No.
Okay. We're going to do a little deeper palpation. We're going to do AP palpation of the spleen here. Any tenderness there?
No.
And of the kidneys, same thing. Any tenderness?
No.
Okay. And AP palpation over here for the kidneys. Any tenderness there?
No.
We're going to do the liver here. I'm going to have you take a deep breath in. I'm going to kind of hook under the ribs and then have you breathe out.
Okay.
So take that breath. Okay. And exhale. Good. Any pain there, tenderness?
No.
Good. We can't feel that, so we know the liver is not cirrhosed. Going to move on to the hips. We're going to push down. Any tenderness there?
No.
And push in. Tenderness there?
No.
Okay. We're going to do some range of motion here. Bring that knee up to the chest. Tenderness there?
No.
And out. Any tenderness there?
No.
Same thing on this side.
No.
No. And
no.
okay. I'm going to have you sit at the edge of the bed again. We're going to move to the lower extremities.
Okay.
So first we're just observing. We're looking at the knees and the ankles and the feet, checking for any swelling, any deformities, any tenderness here in those areas, Nicole.
No.
Okay, and no swelling is noted. We're going to check range of motion. I'm going to have you lift that right leg up and down, up and down. Those feet to the floor, to the sky, toes down and up, and those ankles. Any tenderness there?
No.
Okay, we're going to check deep tendon reflexes down here, so just kind of let that relax. Good. Good. And then check Achilles. You're going to rest that in my hand. Good. A little tense there. Good. And then we're going to check Babinski reflex. Sorry. Those toes curl a little, so all reflexes are intact. We're going to then move on to our neurologic exam. So a lot of the neurologic we're going to explain. So first, we're going to do dystaxia. So right heel down that left shin and other. Good coordination. So one of these tests that we do is exteroceptive. Basically, we'll have a cotton swab, a little toothpick, and a cold end of a metal instrument. We're going to test bilaterally down the body, and you're going to tell us if it feels soft throughout, or when we go to the sharp, throughout, or cold throughout. So
Okay.
some tests there. Then next we're going to do proprioceptive, which is going to be kind of distal thumbs direction while your eyes are closed. So I would go up. You would tell me if that thumb is going up or down. We do that bilaterally, and then we do that on the toes as well, that distal area. Last one that we would check, we also do vibratory with that proprioceptive. The other one is cortical sensation. What we're testing there is, again, with your eyes closed, we're going to place a couple objects in your hand. It's going to be a coin, a paper clip, and a key. You're going to identify that object with your eyes closed. The other thing we do is, with eyes closed, taking that palm and drawing, say, like a square on there, and you're identifying that square with your eyes closed.
Okay.
So those are kind of our neurological exams. Next, we're going to kind of go up to watch you walk.
Okay.
So have you walk down to the side. We're checking for coordination, balance. Come back on your toes. Good. And then this way on your heels. So good coordination here. And then heel to toe. Good. Perfect. Now, kind of last thing we're going to do for neurologic is Romberg test. You're going to have hands out, eyes closed, and we're noticing that there's no alter or wander. Even with a little push, body is able to recenter itself. So then we're going to check the spine, Nicole. So I'll have you flip around here. We are just observing that there is no curvature, that we are symmetric. I'm going to have you bend down, kind of dive down towards those toes. We are looking at that spine. Any tenderness when we're palpating here?
No.
I'm going to stand you back up. Arch that back. Good. Full range of motion there. We're going to check with those side to side with those hips. Good. And good. Thank you. I'll have you take a seat. And thank you very much, Nicole.
Thank you.